Going Rural Health. In this short video, we will answer some questions about going rural health that you may be asking. Things like, what support do they provide? Why are rural placements worthwhile? And what do students say about going rural? But before we get into those questions, who are Going Rural Health? Going Rural Health is an initiative funded by the Commonwealth Government, Department of Health in Canberra, through the Rural Health Multidisciplinary Training Program. They exist to support students enrolled in a nationally recognised nursing, allied health, or other health science undergraduate or postgraduate degree at any university in Australia. Let's explain this with an example. Meet Jane. Jane is an occupational therapy student about to commence her placement at a clinic in Shepparton. Jane's university introduced her to the Going Rural Health team for support. Jane is potentially eligible to receive the following from Going Rural Health: subsidised accommodation and money for travel costs. Going Rural Health can also provide Jane with mental health support, local area knowledge, education for both Jane and her supervisors, mentoring support, placement matching and creating, and cultural training. Moving on now to answering the question of why should you study rural? Other than the obvious and biased answer that rural living is the best type of living, we have listed some notable advantages of completing a rural clinical placement based on student and supervisor advice. Firstly, students become embedded into the team, become one of the team. Our students often say that they feel as an integral part of the clinic they work within. Students get a diverse range of experiences as a result of working in rural health and get to see lots of different practitioners and areas, so they get broad exposure. One of the most important advantages is that students develop the skills that employers are looking for when they undertake rural placements. Things like establishing professional rapport with colleagues because they have to speak with all staff at all levels as part of their role within the team. Advocating for their own profession. Learning to work with finite resources, which instills a sense of creativity. In other words, doing more with less. Functioning as a beginning level practitioner and a challenge to work as a bona fide team member and can make a real contribution to outcomes for clients and patients. And developing excellent time management skills and prioritisation of activities and care delivery. Another advantage of completing a rural placement is that students who do these placements are often highly sought after in the jobs market because of these skills and attributes. And finally, they create long-lasting relationships and a sense of contribution to the community they work within. But rather than us listing all the reasons we think you should study rural, we thought it best you hear from some Going Rural Health students directly. Sit back, relax, and enjoy the show.
My name is Taylor and I'm studying at the Fitzroy campus of ACU.
So my name's Mitchell Matheson. I'm a fourth year occupational therapy student.
My name's Edwina Vajirana. I'm doing a Master in Clinical Psychology at Victoria University.
My name's Annie. I am studying physiotherapy at the University of Melbourne.
I'm Kirsten. I'm from the University of Melbourne and I'm studying physiotherapy currently in my second year.
I'm Erin. I'm also studying at the University of Melbourne and I'm also in my second year of my Doctor of Physiotherapy.
I'm Melanie and I'm from Monash University and I'm doing Bachelor of Occupational Therapy.
My name's Chelsea. I'm studying occupational therapy, third year, and I'm from ACU.
My name's Ruby. I'm studying occupational therapy in third year and based at ACU.
The main differences that you find between like metropolitan placements and rural placements, it's the physio group at Rural Health is obviously just a lot smaller. There's only a group of, I think, 4 physios in the entire hospital. So you being that extra person is just, you make up a pretty significant amount of that team. So that's really cool. And you do feel like you are making a difference and taking on some of the wait list patients. So I felt like I was making more of a difference in the rural placement compared to my metropolitan placement.
I sort of found that I have had placements both in the metro setting and the rural setting. And I found that there is a slight sort of difference in the culture in some of the workplaces that I've been at. I sort of enjoy the slightly more relaxed, sort of friendly nature that the community, like more rural setting gives you. I think you sort of develop sort of some deeper relationships with people. And just from my experiences anyway, I think, you build those interpersonal relationships really well, just because it's not as a fast-paced environment.
In a rural placement, and especially in Euroa, that being the only clinic in that sort of area, you kind of you couldn't just work with, things that you've already worked with, such as depression, anxiety. You see a range of different sort of psychological illnesses.
Having community and just a lot of variety of patients. I think that's something that I didn't really get a lot of experience and a lot of face-to-face contact with.
And another major difference that I found was the fact that rural health practitioners are just more of a generalist sort of practice, as opposed to the specialized placements that I had in the city. In the city, I was just in the cardio ward as well as palliative care. So that was a very specific patient population, which was really good to experience. However, in rural health, you got to see just a really wide variety of different patients. I feel like it was just a combination of all my placements in one.
I would say one of the biggest things is that a lot of people wear multiple hats.
Yeah, there was just so much support. I think that really was a highlight of it. I don't think we could have got through that 5 weeks without that support from Rural Health and from Dominique and all those people that came together.
Something that I really loved was the variety of patients I actually got to work with on this placement. It was a huge age range, a huge variety of presentations, and so I was exposed to a lot, which I loved.
This experience overall has been an amazing experience. I've learned so much, and I can't wait to start working and then hopefully maybe even get to experience this on my own and have a job in this area.
Near the end of the placement, when I was kind of handing off my patients and letting them know that their next appointment wouldn't be with me, and one of the patients, she was like an older lady and she was really very petite and small, and she just held my hands and looked into my eyes and said that she just had such a good time with me, and I've helped her so much, and I'm gonna have a great future, and all just these really kind words that I probably didn't deserve. But she was just so kind, and I think that's just a trend in small towns, is just that they really truly do appreciate what you do bring to the table and how you've helped them.
Do it. You just put it in your application, say, yep, I want to go, because you're going to learn such different skills. You're going to see different people.
If you do get the opportunity to have a rural placement, you're going to be building a skill set that will actually set you apart from a lot of other applicants when you're applying for jobs.
Honestly, you got to do it. It's really, really rewarding.
I think keep an open mind about it. Academically, it was really a very fulfilling experience, and I think it's definitely going to open my eyes to not only how I liaise with rural practitioners in the future, but also just my general practice.
I think even though it can be nerve-wracking, especially if you're having to actually go out there, and it might feel like you're far away from home, it's just such a great experience because you get to see, kind of get that generalist approach. We got to learn a lot about how you get to wear all the hats at once versus other placements, you might be only looking at fractures for the entire placement.
Give it a go. It's an amazing experience. The people are amazing. People from rural communities, I love them so much. I love helping them. I love how open they are. And
I would just say, just do as much as you can and come and learn. I think learning and actually experiencing and going through these things is such a big learning curve for everyone, and you'll get a lot out of it.
Definitely don't knock it till you try it.
If you're needing any more information on the services and support we can provide, contact us today. Going Rural Health have offices in Shepparton, Wangaratta and Ballarat. Find out more at our website or contact us on any of these details.